Hi, my name is Dr. Ross Hauser. Welcome to the Hauser Neck Center here in Fort Myers, Florida. Here with somebody who you're just going to grow to love, Season. Now, when did I first start seeing you, and then what led you to come here? Because you had so many things going on, and then you were really at a desperate state when you first got here. How long ago was that?
That was December of last year.
Okay, so a little over a year. Mm-hmm. So now you've been my patient for a year. So tell us what state you were in like a year ago, because it was really bad. I mean, really, really bad.
You want the whole body or just the neck?
No, you could do the whole body, but emphasize like the things, because mentally,
yeah.
Mental illness, you were really struggling, like really struggling.
Yeah, I had 20 out of 10 pain is what I used to say, because 10 is not enough. It was absolutely excruciating. I had insomnia. I had constant, unbridled anxiety. I had suicidal depression. I had an application in to a Swiss clinic for assisted suicide. I was scheduled to get craniocervical fusion for craniocervical instability, which is the instability of the head connecting to the neck. It was causing a whole bunch of neurological symptoms, including dissociative episodes.
Explain that for people who don't know what a dissociative episode is.
Sure, yeah. Dissociative episode is when you feel so detached from reality and from yourself that you are unsure what's really going on, and you can't feel your feelings, and you can't really articulate anything because you're so disconnected. And I had hallucinations too, which are, visual abnormalities, different things appearing to me that weren't really there, auditory hallucination, hearing things that weren't really there, terrible paranoia to the point where I thought that everybody actually hated me. I thought that no matter what I said, that people would think I was a bad person, and I thought that I was being punished for being a bad person, and that's why I was in such terrible pain. And it's hard to explain what that level of pain is like to people who've never been through it. But I was in a neck brace for 2 years. I was unable to ride in a car without the slightest jostling, laying me up for upwards of a week, sometimes more, depending on how bad the jostling was. And I mean just going over a speed bump. I couldn't function. I was mostly bedbound. I couldn't wash dishes, cook meals, do laundry. I couldn't even pick things up off the floor if they fell.
And it was really destroying your marriage, right?
I was having,
like, you loved your husband, but it was just like you just couldn't do nothing.
I was having drop attacks that he was having to pick me up from. I was wheelchair bound a great deal of time. He was having to push the wheelchair. He was having to do all of these things for me. And he was also experiencing a lot of mental health issues too, because he didn't know that he also had upper cervical instability.
What kind of things was he going through?
He had dissociative episodes as well, worse than mine, to the point where he would just stop in the middle of the room and space out and look at the ceiling, and I'd call his name, he wouldn't hear me. He had a central tremor in his hand. He was afraid that he was going to end up with Parkinson's like his grandfather. He was depressed, anxious, also insomnia, and he would have these explosive emotional episodes that, of course, with all the stuff I had going on, was just unmanageable for both of us. And really, it was partway through treatment where we ended up separating. And that's before he got diagnosed. When he got diagnosed, my heart softened, because when we found out that he had such severe intracranial hypertension, I understood what it meant because of all your videos. And it explained a lot of what was happening for him, and I had compassion for him.
Maybe what we'll do is we'll tag his interview onto this too, because that might be good to interview him, because he's also been a patient.
He is a patient, yeah.
So obviously you came here with hope, right?
Well,
so how long after we started treatment, did you actually really start to feel like, geez, like this could be the answer, like prolotherapy, and then?
Well, if I may just say, it was actually before I came here
Okay.
that I thought that, because the insurance denied the surgery, and I had lost hope at that point, and it was another caring medical patient who posted a video on her own YouTube channel, Rachel Elizabeth.
Oh, great.
She posted, she had craniocervical fusion, she had terrible cervical instability, and her journey was long, but she went from being mostly bedbound to, I think it was 3 days after my surgery got declined, she posted a video of her rock climbing.
Oh, wow.
And
That's
she
great.
Said, and she said, healing is possible.
Oh.
It's hard, but it's possible.
Okay.
And that was the decision I made. A week before we came out here for the first time, and the insurance company approved the surgery. And I made a decision right there in faith because of what I saw Rachel go through.
Wow. That's
So
great. That's like the power of the internet, like in a positive way.
Yeah. And I just knew at that point, because I'd watched the videos for so long, that this seemed like the most logical treatment for the underlying condition that I have.
So explain your response, because it's been a year, so it took a while. You got, like, when did you really feel like I can beat this, or I can?
You know, you posted a video that said it takes 4 months for thoracic outlet to resolve. It took about 4 months for thoracic outlet to resolve, to be resolved enough for me to really have hope that I could live a life with at least manageable pain or better.
Yeah.
Or pain that wouldn't interrupt my life, or possibly even no pain. And I actually have parts of my body that have been treated here that don't have pain at all anymore.
So I think I've done your neck. You've had prolotherapy in your neck about 8 times, give or take a time.
Yeah.
So how are your brain symptoms? How's the anxiety, depression?
Yeah.
How's your brain doing? Like, have you had drop attacks? Like, how are you doing?
Yeah. Yeah, so I was having drop attacks a lot. Now I don't have any. I don't need a wheelchair at all anymore. I don't get dizzy when I stand up. I've been able to make it, I don't know, 6 or 7 hours without doing the brain drain, which those of you who watched Caring Medical videos know what brain drain is, and not been symptomatic.
Okay.
And that's not something we practice on a regular basis. It's just something that occasionally happens because we're able to actually engage in life more and be involved in our church and things like that. So I don't have depression symptoms that I even register at this point.
Okay.
I think that it falls within the normal range of human emotion, if there is such a thing. I don't have what I would consider to be clinical anxiety. I've taken the Beck inventory for depression and anxiety recently. They're very low.
Okay. Did you, here, I forgot to ask you, when you first got here, were you on a lot of meds? Because, you know, when you say depression and anxiety, we're talking about, like, you've had lots of psychiatric evals, so it isn't like, this is like years and years where psychiatric diagnoses, like you had those things.
I had major depression with psychosis. I had generalized anxiety disorder. I had CPTSD and regular PTSD. C just means complex. So I had complex PTSD as well as just standard PTSD, if there's such a thing as that. I also had been diagnosed with bipolar disorder in the past. And I had tried so many different medications and was non-responsive. I tried pretty much every class of antidepressant and anti-anxiety medication. I tried mood stabilizers. I tried antipsychotics. None of them worked.
Okay.
I had nothing but terrible side effects, and none of them resolved the issue.
So when you got here, you weren't on a bunch of meds then? No. Okay. Okay.
I couldn't be.
Okay.
I tried to be, but it didn't work.
Then one of the things you had mentioned was insomnia. So how's the sleeping going?
Yeah, I sleep about 7 to 8 hours, fair to good, per night.
Okay.
And when we were here, for the first few months, it was about 3 to 4 hours, very, very broken.
Okay.
So that's pretty excellent.
Okay.
Yeah.
And then any other symptoms, swallowing, digestive, tachycardia, POTS, mast cell?
All of those.
Did you have, okay, I know, why don't you just explain, because, like long story short, because there are folks that would say, mast cell, you can't really resolve it, or POTS, you can't really resolve it. So
Yep.
explain what symptoms you had before and then how are you doing now?
Yeah, so with dysautonomia, I would stand up, and within 20 minutes of standing, my heart rate would get up over 130, 140, 150 easily, and then my blood pressure would drop down below 80 over 50.
Would it take that long? I mean, it would take like 20 minutes. It wouldn't be like...
The increase in the heart rate would be immediate. It would climb and climb and climb and climb
Oh,
every
okay,
minute.
so it'd be, okay, I gotcha.
And then at 20 minutes, I would have to sit down, or
Okay.
I'll feel like
Okay.
I was going to
Gotcha.
fall over.
How's that
But it would
symptom doing now?
It would take up to 20 minutes for
Okay.
the blood pressure to get that low.
Okay.
So
But now you can, like if we went for a walk or whatever, you'd be good. Like that you wouldn't have to...
I can be up for 2-3 hours at a time, and it's never my heart rate that makes me
Okay.
have to rest.
Like you
And
can go to church, sit through a service, up and down,
fellowship
at
afterwards.
fellowship, and then it's
Yep.
like, it's almost like a normal person.
It's almost a normal level of functioning with
Okay.
dysautonomia, for sure.
Okay.
I would say that my heart rate gets to about 108, maybe 112 if we're really doing a hike or something like that.
Oh, okay.
Yeah.
Do you know what your baseline is? In other words,
67.
This is an interesting question. So when you first started, do you know what your baseline was?
When sitting or laying down?
Or when you said your baseline is 67
That's
now?
sitting upright if I've been kind of engaged in doing
Okay.
things.
Do you know, did it go down from 85 to 67 or?
It was 80, I think it was up to 88.
Because, the stronger your vagus nerves are, the lower it should be. So that's another sign that your vagus nerves got better.
It was at least 85.
Okay.
Sometimes higher.
Okay. Yeah.
Yeah.
Because, I wear an Aura ring. It's amazing how your baseline heart rate, like I had recently, because I was getting that cold that everybody was getting. Yeah, it was amazing. Like my baseline heart rate went from 63 to it's similar, 85 or something.
Wow.
Like even before you're sick, it'll start there's a stressor on your body that's raising your pulse. So that was very interesting to me. So talk to us about mast cell, because you hear a lot about mast cell and
Mast cell is horrible. I have so much empathy for anybody who's in that situation. It was so bad that I could eat 5 things. It was just awful. I was on mast cell stabilizers, I was on antihistamines, I was on all kinds of herbs. It was so expensive.
Did you get hives or you'd get the breathing?
Hives, rashes, massive, terrible bloating, headaches, blurry vision, coughing, swollen airways, gosh, what else? Mood episodes, brain fog, dizziness to the point where I felt like I was going to pass out. I would actually get blackouts to the point where I'd have to lay down after a meal.
Okay.
Where I wouldn't be able to see.
Yeah.
Just.
Can you eat a lot more foods now?
It's just incredible. For New Year's, I made a big feast for some vegan friends of mine, and there were a lot of plant-based foods I wasn't able to eat before, and I was able to eat. And I even was able to eat leftovers, which those of you with mast cell activation know how significant that is. That's just radical to be able to eat leftovers.
Did you? When was the last time you had a bad episode, or has it been 6 months?
It's been 4.
Okay.
Yeah, it's been about 4 months. So
that's great.
Yeah, but the expansion of my diet has been very recent. That's been over the last 2 months.
No, because I've often said that. We all know that there's certain foods that are good for us and certain foods aren't good for us. But if I eat a food, like if Dr. Hauser has some ice cream, or I'm at a party and there's some gluten, and some people might get mad at me that how dare I ever eat a cake with gluten. But I shouldn't get horribly sick. If you have normal vagal function. So somebody who only eats 5 foods, because it's getting more and more common, especially in the patient population that I see. that's not normal. You know, like you should be able to have a pretty expansive diet and not get sick. Like you know, if I have chocolate cake, of course I'm going to probably be tired an hour later, so I shouldn't eat chocolate cake every day.
Right.
But
yeah, I have not been so brave to test the gluten and sugar waters, but
but you're on the journey.
Yeah, just to be able to eat without fear is really.
What about other digestive things? Because a lot of people, they get bloating, they get constipation, so how's your digestive tract been?
Well, I don't want to get too graphic for anybody, but let's say there's an increase in regularity that I haven't had in 20 years.
That's good.
So that's pretty life-changing. The ability to tolerate foods without bloating, without stopping the flow for days or longer. The pain in my gut, I don't really have that.
Oh, great. The vision, prior to seeing me, did you have vision issues? And then how are those vision issues doing?
I thought I needed glasses. I was having double vision. I was having blurry vision. I would have dim, like the light would get dim, so I would almost like black out. And I went to the eye doctor, and I have 20/20 vision. I did not have vision problems. I have 20/20 vision.
Okay.
So now, one perfect example of how much better I'm doing would be after the plane ride here from Washington. It takes a really long time. It takes about 11 hours for us to get here. Without being able to brain drain that whole time, I would have been dizzy and blurry visioned and unable to see in front of me. I'd have to hold on to my husband to lead the way. It wasn't so this time.
Oh, great.
Yeah.
Fantastic. So you'd say the dizziness, lightheadedness, that's way better.
I'd say if it was a 10 out of 10 when we started, that it's probably a 3 or 4 at the worst now.
Now you had other areas proload, so how are the other, like you had your neck proload, so the neck pain's a lot better. How's the other body parts doing?
Well, when we started, anytime I would move my arm up, just up like this and back like that, my shoulder would dislocate. Both of them, they don't dislocate now. No clicking, no popping, nothing.
Oh, great.
Doing a lot of exercises now with my shoulders with the TRX, which is really good for stability. And with my hip, I used to have to put my hip back in place before I stood up every single time. Now I can stand up, no problem. I actually don't have to get my hip treated anymore.
Oh, good.
It's stable. I also had thoracic outlet syndrome, so I had an unstable clavicle bone, and that's been resolved as well. So I don't have.
Oh, great.
I don't have unstable clavicle bone anymore. I also had my entire spine treated, so the whole cervical spine, all the way down through the SI joint. I'm still in treatment for my neck and my SI joint, but the whole rest of my spine is finished being treated. It's
great.
It's not unstable anymore.
Susan, that's amazing.
Yeah. So
now
my knees and my ankles.
Okay.
And I only have one treatment left on the left knee. My knees and ankles are.
And I've been treating your neck, and then Danielle, the physician assistant Danielle Matus, she's been treating all those.
She's amazing.
Yeah, she's amazing.
Yeah.
Yeah, I don't know if people know this, but I also go to Caring Medical, but
you do?
The doctor's a little bit out there, so I actually go to Danielle too.
Oh no!
But you had mentioned Jace, your hubby, who's great. He's getting under treatment. So have you seen changes in him? Like he's a different person too.
From the first time that he did the curve correction protocol,
okay,
he was different, and then after his first treatment, he was even more different, and within, I would say, 6 weeks of the first treatment, he was a different person. And with each subsequent treatment, and he's getting his 5th, he just had his 5th today. We are fully reconciled in our marriage, and we actually have a marriage. We can...
Like you have fun, you're laughing,
We have fun, we laugh, we have emotional process, we have emotional connection and intimacy and all the things that we didn't have before.
I'm going to ask you a very interesting question, because there's going to be people who are watching this. Because you understand, like, obviously there's mental illness because of bad circumstances. Like we're not saying that all mental illness is related
No
to
way.
like neck structure.
No,
but
sure.
how would you advise somebody if you were advising them as somebody who's now on the other side of when somebody could recognize that it's a neck problem causing the brain problem? So what would be some things you would tell somebody that it might be a neck problem?
That's a great question, because both my husband and I, now that we are informed, we're walking around constantly seeing people who might have a neck problem. Once you know, you can't not know, and your heart just breaks for people. I would just say for myself, the key indications were that I wasn't responsive to other treatments, or that other treatments were never going to resolve the issue, that it was requiring more and more and more and more and more,
Okay.
just to maintain a base level. If that's going on, then the treatment isn't actually therapeutic, because therapeutic means that it's working and it's stabilizing.
Okay.
If not able to be stabilizing and you're just needing more and more and more and more and more and more just to try to keep your head afloat, if you're feeling totally hopeless and you look at your life and you can't necessarily identify why, if the pain seems like it's all there is, if no matter what you do, you're trying to make your relationships work and they don't, if whatever you do to try to connect spiritually and you can't, if you can't actually feel the love of God, if the world just seems so dark that you can't see the beauty anymore, even though your heart knows beauty and it doesn't seem like you, if people in your life are noticing that there's just a decline happening in your mood, in your personality, in your functioning, in your attitude, in just being around you, that's starting to bring people down and you don't know why. If you can't even tell that you're doing as bad as you are compared to what other people are telling you. If you've tried all of these things and they don't seem to work the way they're supposed to for you, but they do for other people. If no matter what you do, it seems like your health is a sinkhole, financially, emotionally, that just drains the life out of everything good in your life, then this might be the place. This might be the place to get treatment, or at least be assessed to see if this could be what's going on, because at this point, now that I understand things, I've read Curing Chronic Pain with Prolo, Doc's book, and watched a great deal of the videos, and it really is a re-education, and I know that can be overwhelming. That can seem like it's just too much, but let me tell you that the statement they make here, that they're in the business of hope, it's real, it's true, and to be given hope from coming to a place of greater understanding is such a tremendous gift, to be connected to our bodies so that we know what's going on. Now, if we start feeling a little bit off or weird or strange or just not very good, we go and lay on the dinner roll. We go and do a brain drain. We take a rest.
Explain the brain drain, what that is, for people who haven't watched the videos.
Yeah, so brain drain is a key part of treatment here in Caring Medical. When the interjugular vein in the neck is blocked because of the instability in the upper cervical areas, C1, C2 area, it causes a buildup of cerebrospinal fluid in the brain. And the brain can't empty like it normally would. So that fluid is supposed to be in a constant rhythm. It's supposed to flush through your brain and then bring out waste. And when there's a block from cerebral spinal fluid being able to exit the brain, your brain's basically sitting in a toxic soup for extended period of time until you lay down. If you just lay down for 5 minutes every hour, the brain can actually flush, and then it works a lot better when it's not sitting in a toxic soup.
And then we try to we do figure out in the office here, like what position to lay down in, but normally it's in the extended position. Usually it's in the extended position.
So we do something that we found is really helpful, is that when we lay down, we actually use the dinner roll to lay down.
That's good.
And that's the orthotic device that is part of curve correction here at the clinic that puts your head in a slight extension when you lay on it.
If you think about it, like, why did God make us to sleep? Well, he made us to sleep for lots of different reasons, and there are spiritual reasons for it. But basically, for us to be healthy during the night is when the brain gets rid of the waste products, and then the brain consolidates the memories. Like, if there's some memories that, like, even just remembering this, like 10 years from now, you might actually remember this.
Right.
But that's only going to occur tonight if tonight, like, your brain is trying to put into memory, into the computer, the things that happened today. So that's why when you have the brain toilet obstruction or your brain can't do that, you just can't remember things. So what we do in the office here is just figure out what position you need to sleep in, ideally, that maximally has your jugular veins open. So the jugular veins are like this big, but all the other veins that drain the brain are really small. So it's like, would you rather have the water flowing through a river or a little creek? Like, it can flow through the little creek, but it's not meant to do that, and the pressure is going to build up. Then the creek's going to overflow. Then it's going to destroy the house near the creek and the community near the creek, because the water is supposed to flow down the river. So in the human brain, if the water can't flow down that river, which is the jugular veins, then the cerebral spinal fluid, the little creek, it's going to destroy brain tissue. It can destroy your eyes. It can destroy the hearing nerve. You can get hearing loss or vision problems. It can destroy the part of the brain that has to do with the autonomic nervous system.
I had tinnitus, by the way. I don't have tinnitus anymore. So that's one thing about that.
That's awesome. Here, like, there's people that are afraid of shots. So, like, how do you overcome like prolotherapy is shots to stimulate the ligaments to tighten.
I get sedation, so.
But that's good. So let's just talk about that.
Sure.
So that's exactly right. Wasn't it your first one where we tried to do it without?
We did 2 treatments without, and it was.
But it was so many body parts. Like, let's be honest, it was a lot of body parts.
But my pain was so severe that I don't know how it works, but I just, for some reason, didn't have any pain threshold left. So
no, and then we talked to you, so explain what happened. So we have a nurse anesthetist.
I was offered conscious sedation, but for people with Ehlers-Danlos syndrome, that often doesn't work, and it did not work for me. So there was another option. Troy is an incredible anesthesiologist.
Nurse anesthetist.
Nurse anesthetist, that's the word
nurse
for it.
anesthetist.
Yes.
And he can do propofol.
And he does propofol and ketamine. That's really, really easy. It gets out of your system really fast. It's a fast recovery, and I don't feel a thing.
And then Jace, he's able to do it just with. Does Jace, does he take any medicine, or he does a cold turkey?
My husband is a cold turkey guy.
So he doesn't get anything, but let's be honest, you get a lot more body parts than him, right?
Well, I used to.
But now you're down to just a few body
just
parts.
3, no.
But that's kind of good too. So if somebody is fearful of needles, you can get where you're basically knocked out.
Well, conscious sedation does work for some of the patients. I've talked to some of the patients here, and that works well for some people, as enough to just calm the nerves. So
I had a patient this morning where we did conscious sedation, but propofol, you really don't remember anything.
Well, you tell me, am I awake during my treatment?
What it is, you probably don't know this, but we ask you to turn over. So you understand you can't turn over unless you're listening to us and you're turning over, right? It's not like we carry you and you're like a pancake.
I had no idea.
No, that's exactly it. So that's the good thing about it, is that you really don't feel anything and you're still conscious, but here
I was feeling
terrible. Because like, how could you turn over if...
Well, I thought that it was like a group effort that you guys rolled me like a burrito or something, and I always feel so bad about that.
There's a little bit of that, but no, it's you're.
Wow. I had no idea.
Yeah.
How cool.
Yeah.
Well, I'm a bigger fan of conscious sedation now that you don't have to actually turn me over yourself.